Well, what do we have here? Looks like you have stumbled into the wakier show of the sides of medical's universe. Our talks on nasopharyngeal cancer. I'm Sunway, not Sunway Medical Center, not Sunway Lagoons, but it's Sunway from National Cancer Society of Malaysia, a community health executive. And tonight, I am your friendly neighborhood moderator, here to turn these topics into a laugh riot. Okay, now I know what you're thinking. What is nasopharyngeal cancer? Is that a real buzzkills? But fear not, my friends, because today we are flipping the scripts. Without further ado, I would like to introduce the speaker of the day and also a fabulous doctor, the NCSM's Deputy Director, the most welcome Dr. Vicky. Knock, knock,
Hi,
knock.
Sunway. Hello, how are you?
I'm good. How is you? How was your
I'm
dinner?
good. Yeah, I just had my dinner. Thank you for having me tonight to share on nasopharyngeal cancer. So, I think I will start with my slides without further ado.
Can. Dr. Vicky, I
Okay.
have a fun fact that I read online that
Yes.
nasopharyngeal cancer is rarer than finding a four-leaf clover in your backyard. Why is that said so?
Sunway, sorry, I didn't get your question. Can you repeat?
The cancer is rarer than finding a four-leaf clover. The the
Uh huh.
four-leaf clover in your back. I mean, it's rarer than finding that thing, the lucky leaf.
Okay, so are they trying to say that nasopharyngeal cancer is rare?
Yeah.
Okay, so it is not as rare as they think it is because based on statistics, it's actually the top five cancer. It's one of the top five cancer in Malaysia.
Oh, then
Yeah,
this fun
it's
fact can
not
be
as
neglected.
rare as it's not as rare as you think it is. Yes, so probably I can share my slides, then you can understand further.
Can, no problem.
Yeah. Okay. So let's see. So I am representing the National Cancer Society of Malaysia today. This is NCSM's building. We have three major wings, which is educate, care, and support. So I come from the care wing where we conduct active cancer screenings and also a little bit of cancer awareness. So that's what we are doing today. And the topic given was nasopharyngeal cancer. So, what is cancer? So, cancer is basically any cell that is growing out of the norm. Okay, so we have normal cells. Then when these normal cells grow abnormally, either they grow abnormally fast, or they grow abnormally big, or they go out of shape or out of proportion, anything that is out of the norm, then they become a tumor. Okay, so that is how cancer develops, okay, in a cellular level. So this is our problem statement. Okay, this is a cancer landscape in Malaysia. We have three main issues. Okay, number one is late diagnosis. More than 50% of our patients are diagnosed at stages 3 and 4. Almost for all cancers, we are giving late diagnosis. Okay, because of late diagnosis, they have delayed treatment. Okay, because the later the diagnosis is, the heavier the treatments are, the more meticulous the treatments are, and it's more expensive as well. So the access to all forms of treatment is not readily available in other states. So delayed treatment is not a good thing for patients. And of course, the third thing is low awareness and poor mental health. So our patients mostly have no awareness on what is the symptom of cancer. If they have a growth or an abnormal lump, or if they are losing weight, then they think it's yeah, I think it's also a cultural belief, right? So sometimes they think it is something to do with some cultural, somebody has done something of a black magic nature to them, or things like that. But they never think about cancer, but it's more commoner than you think. Okay. All right. So, Malaysia's cancer treatment journey actually starts from prevention. Of course, prevention is better than cure. So, we heavily educate, especially NCSM, we heavily educate that The more healthier your lifestyle is, the lesser your risk of developing cancer. Of course, there are some unavoidable risk factors such as aging, gender, and also family history, but there are avoidable risk factors. Okay, what we are trying to do is avoid the risk factors that contributes towards cancer. Then we have screening. So today I will cover what are the screening tests that we can do for nasopharyngeal cancer. So screening means you get something checked before you get the cancer. If you already have symptoms, then it's not called screening, it's called early detection. Okay, all right, then we will diagnose. Okay, because screening is just a test to predict you might have cancer. Okay, you still have to go for a diagnostic procedure to confirm whether you have cancer. Then we start treatment. Okay, after treatment is of course survivorship. All right. Okay, so can you see my screen? Okay, my screen seems to have lots of NCSM background suddenly. Is it the same? Okay, anyway. I will cover definition, statistics, classification, risk factors, sign and symptoms, screening and diagnosis, treatment options. Okay, yep. One second. It feels like the system is having a glitch. Yeah, okay. So, what is the nasopharynx? Do you have any idea what is the nasopharynx, Sunway? Since the picture is there anyway. Yeah. So the pharynx is actually located behind the nose. Okay. So the area from the ears to the neck. Okay. So the pharynx is divided into three portions, which is nasopharynx, which is behind the nose. Then you have oropharynx in between. Then you have the hypopharynx below. And then after that is our beginning of our digestive system, which is the esophagus, and also the beginning of our trachea, which is our part of our respiratory system. So it's the upper part of the throat. Okay, we can actually view the upper part of the pharynx by just opening our mouth. When you make the noise ah, and you put a torchlight in, then you can view. Okay, all right. Next. Okay, so what is nasopharyngeal cancer? It's when an abnormal growth comes at that level. Okay, so of course, if it's at this level, what is nearby? The ears is nearby, the eyes is nearby, the brain is nearby, the jawbone is nearby, the nose is nearby. So all of these can get affected. Okay, so it starts as a lump here, it starts as a lump at the neck, and then all of the other parts that's nearby gets affected. As we know, cancer spreads very quickly. Next. Okay, so statistically, as I've told just now, yeah, actually, nasopharyngeal cancer is the fifth most common cancer in Malaysia. Of course, nothing beats breast cancer and colorectal cancer. Then we have trachea, lung, and bronchus. Then we have lymphomas, and then we have nasopharynx. In fact, it's more common than prostate or cervical cancer or liver cancer or leukemia. In fact, okay. Next. Yeah, so when we compare male and female, the male gender stands a higher risk of developing nasopharyngeal cancer. So you can see the female has got no nasopharyngeal cancer at all. So the entire statistics was taken from the male pool. Okay, next. All right. So nasopharyngeal cancer, how do we classify? It's actually a tissue sampling lah. Once you confirm the diagnosis, what we do is a scope via the nose. Then we go into the throat near the nasopharynx area. Then we punch and take out the tissue. Then we send to the lab. Then we look under the microscope and then we get to know, okay, this is a squamous cell carcinoma. This is the commonest type of nasopharyngeal cancer. Okay, because it comes from the lining that is there. Okay, naturally the lining behind the throat, mouth, larynx, nose is the squamous cell. And then we have the next type, which is adenocarcinoma. Again, it is a tissue sampling diagnosis. It's called histological sampling. Then we have lymphomas, melanomas, and sarcomas. All these are coming from surrounding structures and contribute to having a cancer in the nasopharynx. Next. Okay, so stages in nasopharyngeal cancer. This is stage zero. Okay, next. Okay, then this is how stage 1 to 4 looks like. So you can see at stage 1, stage 0 to stage 1, you can't really see much of a growth. Okay, but at stage 2, stage 3, stage 4, you can see a heavy growth forming. And this view can actually be seen once the patient opens their mouth. You can actually see a growth on the throat level. Okay, next. Okay, so what are the risk factors? Now, this is our favorite slide for every cancer presentation, because this is how patients know what should I do to protect myself, what should I not do to avoid cancer. Okay, so number one, diet. So nasopharyngeal cancer is associated with high salty food, processed food, and curated meat. Okay, so curated meat means like ikan kering, ikan bilis and all that lah, sotong kering and all that. So Malaysian diet, we don't have to tell. We have all this in our daily diet. Yeah. How about you, Sunway? Did you have any of this today?
I keep a very healthy diet eating salad.
Yeah, that's good. Okay, because it contributes towards being a risk factor for nasopharyngeal cancer.
Oh,
Gender, the male gender stands a higher risk.
oh my
Lifestyle, of
God.
course, a sedentary lifestyle. Any sedentary lifestyle contributes to any sort of cancer, not only nasopharyngeal cancer. Virus. Now, this is very interesting. Most of nasopharyngeal cancer cases are related to this virus called Epstein-Barr. Okay, so Epstein-Barr virus is also known as the kissing virus. Okay, because it transmits through saliva and also fluids. So yeah, if somebody spits or if somebody their saliva is contaminated, especially if it's children's. They like to put toys in their mouth, then they leave it there, and it's a daycare, so another child takes and puts it into the mouth. Yeah, this is the way it spreads. Okay, so and of course for adults it's kissing and whatnot lah. Be creative about it. Yeah. Then family history of nasopharyngeal cancer. Ethnicity, another interesting point. Ethnicity, actually the Chinese community stands a higher risk of developing nasopharyngeal cancer compared to other races. And some of the studies have shown that genetic factor is one contributing factor lah, and also dietary intake. Okay, yeah, and also exposure, occupational exposure. So chemical exposure at work can also trigger risk factor for nasopharyngeal cancer. Next. Okay, so what is the sign and symptom? You see, other sort of cancers, you actually have very clear screening tests. For example, for cervical cancer, you have a pap smear. For breast cancer, you can do a mammogram and a clinical breast examination. However, for nasopharyngeal cancer, we go purely by signs and symptoms first. So signs is something that the doctor see and the doctor decide, oh, this is something significant. Symptom is something that the patient comes and tells. Okay, I'm feeling something. So signs is something that we can see clearly coming. Is it bleeding or is it a lump? Is it a growth on the throat? And then symptom is something that patient is telling, I'm having difficulty to swallow, sore throat, or difficulty to breathe. I'm having a bit of a neck pain, things like that. Yeah. Next. Okay, so a painless lump in the neck is the most common symptom. 80% of the cases is usually painless lump in the neck. So this could be a swollen lymph node infiltrated by cancer cells. So what you should do is do not wait until the lump becomes big. Okay, if you feel that you're having a lumpy sensation on the area of below the neck, and also around the ears, because you have lymph nodes here as well. So if you feel lumpy, even if it's a tiny nodule, do not wait. Immediately get it checked. Do not wait until it becomes a big blown lump, then you go and check. Okay. Yeah. Then the other symptoms are nose bleeding, blocked nostrils, excess mucus secretion, and blood in saliva. So when you spit, you see saliva mixed with blood. It's not purely blood, it's mixed with blood, streaks of blood. Yeah. Next. All right, so other symptoms includes headache, okay, because it affects the brain. It's next to the brain. It's next to the nerves that is coming from the brain, okay. So blood or double vision, face and neck pain, persistent buzzing sound in the ear, so it's called tinnitus. Zzz, okay, that sound. Difficulty in swallowing, loss of hearing, frequent ear infections, and cranial nerve problems. So cranial nerve, when I say cranial nerve, the base is actually at the base of the neck. Okay, the core of cranial nerve pathway is actually the base of the neck. So that's why we have things like blurred vision, loss of hearing, okay, and difficulty in swallowing, because it's affecting the cranial nerve pathway. Yeah. Next. Okay, so if you notice a lump in your neck, do not ignore it. Seek medical advice from the doctor immediately. Next. So there are no simple non-invasive exams or blood tests that can reliably find this cancer early. That is why you have to be very vigilant about your symptoms. If you have symptoms, do not waste time. Quickly go and get it checked, because there's no one simple test that is non-invasive that can diagnose a nasopharyngeal cancer. Okay, again I repeat, because I know this will come as a question later to me. There is no one simple test that is non-invasive that can reliably diagnose this cancer early. No blood test as well. I cannot do any blood test, for example any tumor markers, and say, oh okay, this tumor marker is high, so you have cancer, you have nasopharyngeal cancer. No, it doesn't exist for nasopharyngeal cancer. Okay, it is a collective set of tests. Okay, next. All right, so this is how an Epstein-Barr virus looks like. Okay, so almost all nasopharyngeal cancer cells contain this virus, and the testing for this virus is in their blood test. However, like I said, this virus indicates that you stand a risk factor. It's a risk factor. You indicate you have a higher chance of getting this cancer. It's not that, oh, if I diagnose you via a blood test, I do a Epstein-Barr virus antibody testing in your blood today, and we detect it to be positive, okay, you're confirmed nasopharyngeal cancer. It's not like that. Okay, so it is just suggestive. We still have to go for further testing to confirm, and this virus can be found commonly in the environment. Yeah, next. Okay, so methods of diagnosis. So this is where we start imaging. So we have different sorts of imaging. It's either MRI, a PET scan, or CT scan over the area of head and neck. Is depending on your doctor which one they want to do. Yeah. Next is biopsy. So we do an endoscope. Go in, put the camera, punch out a tissue sample from the area of the nasopharynx, sent to the lab. And serology. So serology is the blood test that I've mentioned earlier to check on antibodies against Epstein-Barr virus. Next. Okay, so nasoendoscopy is, basically in the scope, what they're trying to see is, what the specialist is trying to see is, do you have any abnormal growths? Is there any lumps inside? Any abnormal bleeding, any erosions, signs that are not supposed to be there? That's what they're looking for. And this is usually performed by a ENT specialist. Next. Okay, so what is the difference between screening and diagnostic methods? Screening means you just it's not confirmatory of cancer, but it's cheaper. Okay, diagnostic methods is almost confirmatory of cancer, but it's more pricier. Availability is a bit hard. You have to go to the tertiary hospitals to do it, but it's usually accurate. It's more effective. Yeah. Next. Okay, so these are the modes of treatment. Actually, top on the list is radiotherapy for nasopharyngeal cancer, because it targets the head and neck area. Okay, so you put therapy only towards the area that is affected. Then you have chemotherapy and surgery, but the role of surgery in nasopharyngeal cancer is quite limited, because there's a lot of vital organs nearby, especially the brain and the brainstem. So yeah, it's depending on the ENT surgeon. Yeah. Next. So survival rate, as we know, the earlier the cancer is diagnosed, the better the survival rate. Okay, the later the cancer is diagnosed, the worse the prognosis. So the 5 year survival rate for stage 1 is 72%, quite good, and stage 4 is just 38%, sadly. Next. Okay, so take home message from my talk today is, avoid taking excessive amounts of salted fish and preserved food. Go for natural food. Go for fresh vegetables and fruits. Yeah. Um, Adhere to healthy lifestyle practices for general cancer prevention. 30 minutes of physical activity, avoid tobacco, so avoid smoking, maintain a healthy body weight, healthy diet. So minimize or don't consume alcohol at all, and minimize processed food and red meats. If you want to consume meat, it's fine, but do not consume red meat and do not consume processed sort of meat. Take it fresh. Okay, next. So I've reached the end of my presentation. Thank you for your attention, Sunway. This is our toll-free helpline, 1888 1000. If you have any cancer related questions, you can call and we can assist. Okay, next. Okay, so we also provide dietitian services and psychosocial services. So if you have anyone that is diagnosed with cancer and you think they need support or they need assistance of any sort, you can give a call to our helpline and we can do our best to help. Okay, thank you. Any questions?
I do have some noted questions from the media socials for our main YouTube, Facebooks.
Yeah.
So yeah, uh, from a username named Skylanes Creative. Hi doctor, is there any physical signs that someone have a NPC?
Okay, so hi Skylane, thank you for your question. Yes, physical signs of someone who has NPC is actually lump. They have a painless lump, or they have difficulty in swallowing, or sore throat. Sore throat is actually a common symptom for Epstein-Barr virus, which is a risk factor for nasopharyngeal cancer. And then you will have swollen lymph nodes. Okay, you will have lethargy. The general symptoms or signs that is related to cancer is lethargy, loss of weight, loss of appetite, a little bit of bone pain. Yeah, these are all the signs that you know that is related to this cancer.
Hmm. Can I add on a little bit to that questions?
Yes, go ahead.
What if it's other diseases? I
Yeah.
mean, that symptoms it's other diseases, not this NPC. Would it
So
be
good
possible?
question. Yes, yes, it is possible because usually when okay, for example, you go with a painless lump, right? When you go and see a
Hmm.
doctor and you have painless lump, so usually they will not think of cancer first. So we do a full history taking. That means we see what are your other risk factors in your lifestyle, in your family, in your dietary intake. Are you a smoker? Do you consume alcohol? Blah 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 blah. We check all that first. Next thing is we will treat it. If we think this is not cancer, this is probably an infection, which is also quite common to come from the throat, and you know a lymph node gets swollen. So we might just take a full blood count, check for white cell. Okay, this one is an infection, let's treat with antibiotics. So we will attempt probably a course of broad spectrum antibiotics for a week, then we assess back. But you see, if it's cancer, it's not going to resolve, right? With
Yeah.
antibiotics, it's not going to resolve, it's going to get worse. Yeah, so
Correct.
within the course of one set of antibiotics, probably 5 to 7 days, we will arrive to a diagnosis. We will not delay any further than that. Definitely we will have to refer to an ENT surgeon. Yeah, so you have a good point. Yes, commonness is common, but the term is called high index of suspicion. The clinician should have high index of suspicion that this might be cancer. Yeah.
Hmm. That's informative.
Yeah,
Thanks for the insight.
no
So
worries.
the next questions from Hazi Moktazar. Is
Yeah.
NPCs hereditary? Can it be passed through genes?
Yeah, so thank you, Mr. Hazi, for your question. Yes, nasopharyngeal cancer is it's also a genetically transmittable cancer. So any sort of cancer, actually, if you have genetics of cancer in your family, then you stand a higher risk than the other population to develop any sort of cancer, not only NPC. Yeah. Next.
Hmm. Good. So the next question is from Rajitam. Dr. PK, can I know the prevalence of NPC in Malaysia and who are the most affected group of people?
Hi, Ranjidam. Thanks for your question. So, prevalence of NPC in Malaysia actually is the fifth commonest cancer in Malaysian setting, and it's more common among males than females. And those who are most affected is actually the Chinese population. It's most likely due to genetic input and also dietary intake. Yeah.
can I add on a bit for this?
Yes, go on, Sanvi.
Is there any like age range for this?
Sorry,
Age
is there
range.
any
Age
age
range.
range? Oh, okay. Any sort of cancer is usually diagnosed later in life, so beyond the age of 40. But nasopharyngeal cancer you can develop at any time in your life, because one of the strongest risk factors is Epstein-Barr virus, which can be transmitted even when you are a child. Yeah.
Oh, so no sharing drinks, no sharing foods anymore.
Be careful. Don't kiss anyone randomly as well.
Oh my gosh. Okay, let's move on to the next question from Miss Akila Azman. There's persistent buzzing in ears similar to the condition that we experience when we are in the airplanes during takeoff and landing.
Yes, somewhat the same. But
Like, is
when
it
you take
very
off and when you
painful?
land, it will stop after a while. It will subside.
Mm.
Yeah. Whereas in the case of nasopharyngeal cancer, initially you can probably come intermittent. The buzzing is intermittent, but as the cancer aggravates, the tumor grows bigger, then definitely you will have persistent buzzing. So it's there all the time. Yeah. That's the difference between probably a normal cause of buzzing, which is vertigo, and nasopharyngeal cancer.
Oh, is there any like timing for the buzzing time, or maybe like at night or in the morning after
No,
wake
no,
up?
you can come
Just
anytime.
random.
Whenever
Okay, right.
whatever movement that you're doing is compressing on the cranial nerve that's connected to the ears, then you will have buzzing
Mhm.
lah. So
Oh,
it's
thanks.
up to your
Thanks for the
movement.
info.
Yeah, yeah.
Thanks for the
That's
info.
why you have the buzzing actually, because it's affecting the nerve that's connected to the ears.
Thanks for the info.
Yeah.
So that's our last question from Miss Akila. I think Dr. Vicky, you can wrap up what it's nasopharyngeal cancer.
Okay, so thank you everyone for your attention and the amazing set of questions. I hope that I have created some sort of awareness, and also I've enlightened you a bit about nasopharyngeal cancer. It is not as uncommon as you think, and any form of cancer, we always emphasize on healthy lifestyle, and also balanced diet, and avoid smoking and alcohol. But the other side that we always fail to see is seek early treatment. Okay, so or seek early help when you have the symptom. Do not wait for it. You might be a person who is very vigilant with your health, and you're perfectly healthy with no risk factors. Your family, everyone is fine, no cancer, whatever lah. Tak payah cerita cancer at all in your family, and you can still develop cancer. So how to find out if you have symptom? Go and seek treatment early. Okay.
Okay, if the saying
Thank you.
goes, early detection save life.
Yes, early detection saves lives. Okay. Thank you,
Thank you.
everyone. Thank you,
Thank you,
Sunway.
doctor. Thank you. See ya.
See ya.